Our today's topic is cubital fossa and posterior compartment of arm. First of all, we are going to discuss cubital fossa. What is cubital fossa? It is a space in front of the elbow and it is analogous to the popliteal fossa in the lower limb that lies just behind the knee. So cubital fossa is this triangular space which is covered superficially by the skin and the superficial fascia and the deep fascia. And the superficial fascia has the cephalic vein, the basilic vein, and the interconnecting median cubital vein. Now, the boundaries of the cubital fossa are such that it is bounded medially by the pronator teres, laterally by the brachioradialis, and these two muscles meet inferiorly to form the apex of this triangle, and the base of this triangle is formed by an imaginary line that is connecting the two epicondyles of humerus, that is the medial epicondyle and the lateral epicondyle. So I repeat, the boundaries of this triangular space, that is the cubital fossa, are medially the pronator teres, laterally brachioradialis. Apex is by a point connecting these two muscles. Base is formed by an imaginary line that is connecting the two epicondyles of the humerus. On the floor, we see two muscles, the supinator muscle and the brachialis muscle. In this picture, we can see the various contents that lie in the cubital fossa. Going from medial to lateral, we have the median nerve, the brachial artery, the tendon of biceps brachii, and this radial nerve. So the radial nerve is not visible in this picture. This is the radial nerve that lies on the lateral side. So MBBR, starting from medial to lateral side. Median nerve, brachial artery, biceps tendon, and radial nerve. So this summarizes the cubital fossa, the boundaries and the contents. As I have mentioned earlier, the superior boundary is by a line connecting medial and lateral epicondyles. Medially, we have the pronator teres. Laterally, we have the brachioradialis muscle, and the floor is formed by brachialis and supinator muscles, and the roof is formed by the skin and superficial fascia. Contents are MBBR, the median nerve, medially, then brachial artery, lateral to it, then biceps tendon, further laterally, and the lateralmost is the radial nerve. So M, B, B, and R. These are the contents of the cubital fossa. Now coming to our next topic, that is posterior compartment of arm. As I told you in the video on anterior compartment of arm, the arm is compartmentalized by intermuscular septa, which are the lateral intermuscular septum and the medial intermuscular septum. It was dividing arm into an anterior compartment, which we have discussed in another video, and this is the posterior compartment. So main contents of the posterior compartment are the triceps muscle, the radial nerve, and the profunda brachii artery. Main muscles, the triceps, we are going to discuss this. It has three heads. One head is the long head, the second one is the lateral head, and the third one is medial head. Long head comes from the infraglenoid tubercle of scapula. Lateral head comes from the upper part of the radial groove of humerus, and medial head comes from the lower part of radial groove of the humerus. All these combine and it gets inserted into the olecranon process of ulna. All the three heads are supplied by various branches of the radial nerve, which has a root value of starting from C5 to T1. And the main action of triceps is it is the extensor of elbow joint. In this picture, we can see this is the attachment of long head, the infraglenoid tubercle. This is the attachment of lateral head above the radial groove, and this is the attachment of medial head below the radial groove. This one is the insertion on the olecranon process of ulna. So these are the three bellies of the triceps muscle. The long head, the lateral head, and this is the medial head. The nerve of posterior compartment is the radial nerve, which comes from the lateral. Origin of radial nerve is the lateral cord of brachial plexus, having a root value of C5 to T1. Now in this picture, we can see that the radial nerve originates from the lateral cord of the brachial plexus. It passes through the lower triangular space along with the profunda brachii artery, goes down and posteriorly and passes through the radial groove along with the profunda brachii. Then it further goes down, gives branches, and then pierces the lateral intermuscular septum and comes to lie on the anterior compartment of arm in the lateralmost part in the cubital fossa. So this is the lateralmost component of the cubital fossa. Starts on the posterior side and comes to the anterior side. Radial nerve has a roof value of C5, C6, C7, C8 and T1. In the axilla, it gives a posterior cutaneous nerve of arm, and it also gives branches to the long head and medial head of the triceps muscle. Then comes the upper arm, in which it gives two cutaneous branches, which are the lower lateral cutaneous nerve of arm and the posterior cutaneous nerve of forearm. And then it gives branches to the muscles, all the heads of triceps, in addition to brachialis, brachioradialis, extensor carpi radialis longus, and it gives an articulating branch to the elbow joint. Then further coming down in the forearm, it gives divides into a superficial branch and a deep branch. The superficial branch goes to the skin of the lateral side of the dorsum of hand and lateral 3.5 fingers, and the deep branch gives supplies muscles of the posterior compartment of forearm. Now, which are the arteries supplying the posterior compartment of arm? This is the profunda brachii artery, which is the main branch of the brachial artery, which is the artery of anterior compartment of arm. So what happens is the axillary artery at the lower border of teres major muscle becomes brachial artery. Behind the brachial artery comes the major branch of brachial, which is the profunda brachii artery. It immediately gives off branches, the anterior descending and the posterior descending, and that along it passes behind the humerus in the radial groove along with the radial nerve, comes laterally, pierces lateral intermuscular septum, and then it gives the terminal branches, which I've mentioned, the anterior descending and the posterior descending. The branches are the anterior descending, which is also called the radial collateral, the posterior descending, which is also called the middle collateral artery, and one is the ascending branch, which is the deltoid branch. So what is the fate of these branches? The ascending branch of profunda anastomoses with a branch of the posterior circumflex humeral artery. The ascending or the this radial collateral anastomoses with the radial recurrent of radial artery and takes part in anastomosis around the elbow joint in front of the lateral epicondyle of humerus. And the middle collateral anastomoses with the interosseous branch of ulnar artery, and this takes part in formation of anastomosis around the elbow joint. Thank you.